It has been 2 years since Profhilo was launched in Malaysia, and in my experience, I find that results have been good and consistent. My patients are happy with the skin tightening effects on the face and also the neck. This year, they have introduced Profhilo for the body, which consists of 96 mg of hyaluronic acid in a 3 ml syringe. Treatment areas include décolletage, arms, elbows, abdomen, knees, and anywhere else on the body which has loose skin. The treatment protocol consists of 2 sessions of Profhilo injections to the desired area with a 1-month interval. A maintenance session is advised after about 6 months. You will be given a patch to wear for a few hours post-procedure and a body cream to apply at home. Downtime is very minimal. The post-injection blebs normally subsides within 24 hours and results can be seen as early as 2 to 3 weeks post-injection. This treatment is mainly to address mild skin laxity. If you have thick subcutaneous fats or severe laxity from pregnancy or excessive weight loss, surgical intervention may be the treatment of choice to address the loose skin. Therefore, it is important to consult with a healthcare provider and to assess if you are a suitable candidate for this treatment.